Sometimes we see a condition where kids have pain in the hip, and the doctor starts doing a lot of tests on the kid, and he says the head of the bone going into it seems to have a slip, something to the cartilage. What is that about?
There are certain hip conditions in children that are very common, and a lot of that is going to depend on their age. The one that you're referring to, called the slipped capital femoral epiphysis, is something we tend to see in kids as they start through their adolescent growth spurt. And about 2/3 of these kids tend to be a little heavy for their age.
But a third aren't.
But a third are not. So the usual presentation is we have a kid that complains of either hip, groin pain, thigh pain, or even sometimes knee pain. And they're limping sort of intermittently for a few weeks. Occasionally they'll come in and knee exam will be fairly normal. But in this particular condition, it's very important to identify that the problem is in the hip and not the knee. So as a general rule, the orthopedists or pediatricians, the emergency room doctors, when they have a kid come in with a limp or complaining of thigh or knee pain, will always examine the hip to make sure the hip range of motion is equal on both sides. If after that evaluation there's a concern about the hip, it's very important to get x-rays to exclude this slip condition you're talking about. And the standard set of x-rays that just about any orthopedist or emergency room doctor would obtain are called an AP and a frog lateral view of the pelvis.
If you do diagnose it, how's it treated?
It's a condition that the prognosis, how the kids do, depends on a lot on how much of a slip you have. So as soon as the condition's identified, my general practice is to treat it, which involves a surgery where the kids stay overnight as soon as possible. So what I would typically do is, once I've made the diagnosis, inform the parents, kids would be put on crutches, and usually within 24, 48 hours we try and get them into the hospital and treat it.
Surgery, the purpose of surgery is to do what?
What we want to do is prevent a small problem from becoming a big problem.
And you do what to it?
And what's involved in the surgery is a small incision about a half an inch on the front part of the upper thigh, and we place under x-ray a screw into the bone to prevent any further slip of the hip.
So basically making it more stable.
Right. Making it more stable and preventing progression.
Sometimes you have a kid and they have a hip problem and they say, oh, it's like a thing called toxic synovitis. What does that term mean?
Toxic synovitis is another problem that we see commonly in kids. It tends to be in a younger age group than the one we just talked about with the slips in the adolescents. And the usual time that will come up as a diagnosis is a child that either comes into the emergency room or comes into their pediatrician's office complaining of a limp or even a refusal to put weight on the leg. Most common age range, I would say, for this is somewhere between about age 2 and age 6. And very often when we talk to these children and their families, we find that either they or one of their siblings have had a recent infection, a strep throat or an ear infection. And what this synovitis is inflammation. And the hip is a very common place that will get this joint inflammation. And so what is important is that the orthopedist or the pediatrician does a full exam, and then if they think the condition that they're dealing with is a synovitis, once they've gotten blood tests to rule out an infection and x-rays to rule out an orthopedic problem, the children are usually put on something for inflammation, and symptoms frequently resolve within a day or two.